My name's Scott. I'm a physical therapist assistant here at North Point Orthopedics, and today I'm going to talk to you about some knee pain. Osteoarthritis is where you lose the natural cushion in between the knee joint. It causes a lot of pain and a lot of grinding sensations and possibly even clicking sensations. And so today I'm going to show you a couple exercises that can kind of help decrease that pain and get you moving. So these exercises are going to be requiring you to lay down flat. This is Allison. She's going to be our guinea pig today. She's a PT tech with us. So first exercise is glute sets. That's what we call them. It's really easy. It's just where you take your butt and you just squeeze your butt together. You want to hold it for 5 seconds, 10 times. And you'll notice that she's doing it right as she kind of lifts a little bit off the table as she squeezes from the contraction. So what this does, it's muscle setting. It gets you to gain control of the muscle because as our knees tend to hurt, we tend to compensate as we walk, which causes people to lean forward and it really messes with their gait. So doing these actually helps you activate those glutes to get you to stand tall when you're walking and normalizes your gait a little bit. So the next one, it's called quad sets. This is another muscle setting exercise. It gets you to learn how to control the quadriceps in the front of the leg. Now this is an easy exercise to do. The appropriate way to do it, if you need it, is you can take a towel or a pillowcase or anything you need. You can ball it up, put it right under the crease of the knee, and that's a good cue telling you where to push. So all you do is you want to push that knee down. You'll feel the quadriceps kind of tighten up in here. Same concept. You want to hold for 5 seconds, do 10 reps. So another really good exercise that you could do, it's actually a stretch for the back of your legs, the hamstrings. Reason being is because when your knee is in pain, people tend to like this position of the knee. That could actually cause adaptive shortening of the hamstrings, making it a lot harder to straighten out your knee in the long run. So adaptive shortening is just where these muscles, if they're in prolonged position, it's kind of like when you were little. Your mom tells you don't make that face or your face is going to stay like that. That's actually a real thing in our muscles. But if a joint is in a position for too long, for example, bring your leg back down. Say your knee is like this for too long. Say you leave it, you sleep like this every night with a pillow or something like this. You sleep like this, something under your knee every single night. Eventually, this goes away, your knee will stay like that. Okay, that's not what you want because then it messes with your gait, changes how the way you walk and everything, and it will actually contribute to a little bit more pain, especially in the back of the leg. So what you want to do, we have a strap here that we use in physical therapy. You could use a dog leash, a belt, or even a bed sheet. What you do is you just put it over your foot, just like this. She takes this, and you want to tell them to keep the leg nice and relaxed. If they're getting pain up in here, then that leg is doing most of the work. This strap is supposed to do all the work. So you instruct her to pull straight up so she feels a nice, comfortable stretch in the back of her leg. Should be able to breathe nicely. Feel okay? So your hamstrings, they tighten up right back here. They run from here all the way back in here. And you'd want to hold this stretch for about 10 seconds. You want to do it 10 times. Again, it should be comfortable. You should be able to breathe through any stretching that you're doing. So another good exercise we could do, they're called long arc quads. So Allison is sitting here at the edge of the table. And what I'm going to instruct her to do is to straighten out her knee and hold that for 5 seconds. And then she would come back down and relax in between. She would do this 10 times. Each one is a 5-second hold. What this does is it not only helps keep the mobility with the bending and the straightening, she's also working on that muscle control again on the front of the quadriceps. Again, 10 5-second holds. All right, and thanks for stopping in today. Hope all is well, and if you have any questions, comments, or concerns, come on, stop into the clinic and talk to us. And as a disclaimer, if you are doing any of these exercises and they cause you any pain, be sure to back off the exercise. As I said, pain will cause more inflammation. If they are causing you pain and you can't find a pain-free range, stop doing the exercise, come speak to the doctor. All right? Thank you.